Good afternoon and welcome to the Weekend Wellness Hour show. Today we have a new friend of mine. She is the wife of the husband who I know from a mastermind group I'm in, Joya Van Der Laan. She has many skills in the healthcare world, and I wanted to bring her on because she is an expert at hormones, and she is a family nurse practitioner, functional medicine specialist, and an autism mom. So she has a great wide knowledge of how our body functions and how we can improve our health through looking at our hormones. So I want to thank you so much for joining us today, Joya.
You're welcome. It's great to be with you here today.
Wonderful. Can you tell us a little bit about your background? How did you get into functional medicine? Why are you in this specialty, and what led you here?
Sure. So, early even in life, probably as a teenager, I was always curious about the whys. Why are things the way they are? How do things work? Not only with the body, but even mechanical things. My dad was a very hands-on repair everything in the house type of guy. So I was always curious to figure out how things worked and how I could fix them and diagnose a problem and fix it. So I was always kind of interested in medicine and medical fields and kind of uncovering problems and fixing problems. So that kind of led me to think about a career in healthcare. Um, so I went to nursing school, and even through all that, I was really interested in not so much well, definitely how we do what we do, but why we do what we do and why it works. And how do each of these drugs work, for instance? And then learning, oh, there are maybe botanicals or vitamins that can do similar things or different things that we maybe don't even need medications all the time. My aunt was an herbologist, and did the muscle testing and that whole kind of more natural approach. And so that was something we sort of bonded over. And then even in nursing school and in my master's program, always kind of questioning things. Okay, well, why are we being taught this? Is this really true? What does the research say beyond what the research I'm being taught is saying? So kind of trying to look at issues from all angles and trying to figure out and be a critical thinker. Okay, what's going on in depression, in high blood pressure, in diabetes, in different symptoms related to hormone imbalance, for instance, and then how can we improve those symptoms while really treating the underlying cause. So that's what a lot of functional medicine does, is look at the problem and kind of take some steps back, both in history and kind of in perspective, and go, okay, what's the big problem here? What is the cause? What is the underlying or root cause here? And how can we address that so that then you're not having these symptoms up here anymore?
So you started off in nursing, and then how did you make that jump to functional medicine? Was it additional training you decided to undergo while you were doing nursing to supplement your skills, or was it
Right.
just something you branched off completely different?
I would say I still integrate some of the traditional medicine skills and background that I have learned. The functional medicine piece, again, that really addresses the whys and how. How does it work? Why does it work this way? And kind of being a problem solver and a detective. And since my brain kind of works that way anyway, the functional medicine approach fits kind of with how my brain processes problems anyways. And so in nursing school, there wasn't a whole lot of functional medicine training to do. But once I was in my master's, when I got to choose different projects or my thesis and that kind of thing, I kind of trended towards picking topics that would enable me to learn more about those things. And then also, there's different conferences and webinars, and there's certifications you can get, of course. The Institute for Functional Medicine is where I've taken a bunch of courses, and then A4M, which is the American Academy of Anti-Aging Medicine, so A4M. And I've taken some classes through there. And then a lot of the companies that offer labs and sell supplements, they will offer their own sort of educational, even non-sales related webinars and offerings in that as well. So it's kind of a little bit from everywhere. And then of course, books by favorite authors. So it's kind of, you kind of get pieces from a lot of different places.
Yeah, that makes sense.
Yeah.
Now, you spend a lot of time dealing with hormones in your practice.
Yes.
was there a specific draw to that? Was it related to your aunt being an herbologist and you're like, oh, let's see what we can do to help people with their hormonal imbalances?
So it wasn't so much related to that. I think partially it stems back to adrenal problems, because if we understand how the hormone system works, we have kind of our adrenals and our thyroid and our hormones, and they're kind of in this triangle where if you affect one, you're going to affect the others. And so I kind of started off learning quite a bit about adrenal fatigue, partially because I was experiencing adrenal fatigue
Oh,
from school stress
yeah.
and work stress and kids eventually and all of that, and then realizing how it affects hormones. When I was working initially as a nurse practitioner, I was working in a clinic that specialized in pain management. So I was managing a lot of pain. Well, what happens when you have people on opioid medications, especially long term, is that their sex hormone levels, so for instance, the testosterone in men, but also in women, tends to go down. And they have then these symptoms of depression and fat gain and muscle loss and inability to focus and very low motivation and maybe some depression, some sleeping issues, sleep apnea. I mean, the list goes on and on. Their lipids are affected, right? Erectile dysfunction, sexual dysfunction can follow from that. So initially learning about that with the men, but also realizing, wow, this happens to women for sure when they're on these pain medications as well. So I kind of segued from, or combined really, pain medicine and hormones, because some of these people do need to be on pain medications long term, and then the impact on their hormones has a really important impact on their daily functioning and their daily level of happiness and comfort. So to deal with those hormones while they're on the opioids or whatever medications they're on became really important, because it really was a matter of quality of life. And then the more I learned about hormones, even then people who are not on pain medications, of course, we know women go through menopause and we lose all our hormones, and a lot of us can understand how does that feel, or we've heard from other women, how does that feel when you go through menopause. And I think the hormone therapy is such once you learn it, it's, to me now, such an easy way to make people feel so much better, function so much better, relate in their relationships with people so much better, because they are better, they are feeling better. And it's interesting, all the symptoms that I hear. A lot of times we just think, oh, it's hot flashes, right? Hot flashes with menopause, but it's so much more than that. And a lot of times we don't talk to our girlfriends or even our doctors or midwives or nurse practitioners about this, because it's private, right? I'm having vaginal dryness. I'm having trouble with like a dry vaginal tissue and getting itchiness and irritation and infections, or I'm moody, or I feel depressed or anxious, or I can't sleep, or I can't focus the way I used to. A lot of these problems are associated then with that tank of hormone levels at or around menopause.
Yeah, and it's interesting, back to your comment just a minute ago about pain medications and opioid use. See very, very unstable behaviors and emotions in people who have used opioids and different pain medications for long periods of time. And so it's great to know that the link between the two, to suggest to someone, hey, I know that you've been on these medications for a long period of time. Have you consulted someone to look at what your hormone levels are? And what's great is something that you specialize in, bioidentical hormones, which can provide a more natural solution. Can you dive into what that's about?
Yeah. So as somebody who's into functional medicine, I always want to look at the more natural way to do things. What is the closest to our body's own, in this case, hormone? So, there's Premarin and there's all these over-the-counter hormone creams and pills and all sorts of things, injections even, that we can use. But those are created in a laboratory and are, or they're from a horse or a different kind of animal, and are not exactly the same as what our body is used to both producing, using, and excreting or detoxifying. With the bioidentical hormones, they are a lot of times produced in a lab still. And so a lot of confusion comes in when people think, oh, they're plant-based, many of them are not. They are synthetic. They are produced in the laboratory. However, molecularly, they are the same, identical, bioidentical, as what our body makes. So the benefit there is it's the same, right? So our body's used to seeing that, so it can use it and excrete it well. When you are able to use the hormones well, they are more effective. And when you are able to excrete and kind of process the hormones well, they end up being safer, and there's less risk of, buildup of the wrong kinds of estrogens, the oxidative stress. Right.
Great. So with the difference between them and then pharmaceutical hormones are that the molecules with bioidentical really mirror what's in our body, but pharmaceutical hormones, what's different about that? What's being used?
Well, if you kind of have to sort of look down at the molecular level to understand what's wrong. Maybe it's, if you've ever seen those, right, carbon rings with these things sticking off, right? Maybe it's one of those things sticking off that's not quite exactly right. So in a lot of ways, it may function like our own hormones, but then in terms of, for instance, detoxification, it's not detoxified in the same way. And so then we can end up kind of risking a buildup of especially estrogen hormones. And of course, then we've all heard that risk of, okay, if my estrogens are too high or the wrong kind of estrogens, that increases the risk for things like breast cancer.
Yeah, so why even use pharmaceutical hormones if we have a choice between something that's slightly off versus something that's molecularly the same as our own hormones? Why not just always choose that?
Yeah, so the pharmaceutical companies are very powerful and very, very good at their jobs, very good at marketing, and they influence medical school training too, right? And so I think that it comes down to training and awareness and knowledge. I don't think that the prescribers using the pharmaceutical grade hormones probably in most cases know about bioidentical hormones. Insurance can be another factor there, because many times insurance is going to pay for the pharmaceutical hormones, whereas with the bioidenticals, those are compounded typically. And so especially as of late, in the last 5 years or so, compounded medications are very rarely, almost never covered by insurance. So, it can be a cost issue too. There are a couple of bioidenticals now on the market in terms of estrogens. I have kind of not been using those because I'm so familiar with the bioidenticals and how I can compound them. With the compounding, I can adjust to the micromilligram, right? Like I can say, well, instead of 100 milligrams, we need 105, versus with pharmaceutical products, you're really stuck to whatever increments. Okay, well, they have 100 milligram and then they have 150. But if you need 112 and a half, you're kind of stuck. So the other advantage to compounding is that I can give the patient exactly what they need and adjust it very, very finely. A lot of my patients are quite sensitive to very small changes, and so don't do well with the pharmaceutical, how it's just this dose or this dose.
Exactly. Yeah. And that was actually one of my questions is how specific can you get it? And it sounds like if my hormone needs are different from the person next to me, you can really tailor it to me. And then a question about that, then as I progress along on that bioidentical hormone, if my body shifts, then I would assume you can also shift how the compound is made and adjust for my body's response, correct?
There are a lot of different things I can change. So, for example, so usually I'll do a urine test for hormones to test the estrogens and how they're being metabolized. The urine test is the only way you can see how these urines are getting processed through your body, and are they being processed in that safe way or in that unsafe way, concerning way. And a lot of that has to do with genetics and diet and history and sleep and stress and all of that. So for instance, with the estrogen creams, I typically am using bi-est. So bi meaning two, est, estrogen, bi-est. So there's two estrogens in there, E2 and E3. And actually the way the numbers go, they read it E3 and then E2. So I can adjust the percentages of those even. So with a typical formula, depending on what the lab shows me, I may start off with an 80% E3, 20% E2.
Okay.
Or maybe we start off with a 60-40 ratio, or maybe a 50-50 ratio. And then I can adjust it, kind of a typical starting dose might be a 1 milligram per milliliter, or 1.25, depending on a lot of things, the woman's history and what her testing looks like, what her symptoms are presenting like. If she's got horrible symptoms and her levels are just slightly under normal, well, maybe we dose a little bit differently. So you want to take both the lab and the patient, of course, into account. And then it's not only the estrogens that we use. Whenever I am using an estrogen, especially in a postmenopausal woman, I'm always prescribing progesterone as well, because estrogen and progesterone really need to be in good balance. Oftentimes I find that it's the progesterone that actually helps with the insomnia, and a lot of times anxiety and palpitations as well. Progesterone is a PM hormone, so it's higher in the PM, and I think of progesterone PM sleep and kind of winding down, versus estrogen, which is going to be more stimulating, intended to be higher in the morning. So that's, it also, in terms of timing of dosing, I always have people take the estrogen products in the morning, progesterone products kind of right before bedtime. And then I can also add in various things like testosterone as well, even for women. Testosterone can be huge for women for one's sex drive, libido. Testosterone's low and your libido's gone. And then also DHEA. So that's kind of a hormone precursor as well. But DHEA is also very anti-aging, anti-inflammatory, balances cortisol, balances blood sugar, all sorts of things. It's really good for the adrenal glands as well. So it has those functions on its own, but then also is a precursor to things like testosterone, and then eventually estrogen as well.
That's amazing. So you said that you use urine as one of the ways to test for estrogen. Do you use other methods too, blood work, saliva, anything else?
So once somebody is on the bioidenticals, or really any hormone, especially a topical hormone like a cream, so the Biest that I was talking about is actually a cream that's applied. Urine is the only way to test really accurately for the topicals. Saliva is acceptable in many cases too. I almost never am drawing blood for women's hormone levels. For men, it's a little bit different, because we're testing fewer hormones. I'm concerned about an estrogen issue with a man. But the urine is what I've become most familiar with. And so when you use the same type of test, you kind of become familiar with how it works and its ranges and its, how it's going to look on certain patients. And so part of it is just a comfort level with either the urine or saliva. So you may see practitioners using both, but I very rarely use blood for either initially testing or definitely not for monitoring ongoing hormone therapy.
That's interesting, because I know I've gone to, a regular doctor over the course of the years, and it's typically blood work that's done. Rarely has it been urine or saliva. So I'm glad to hear.
If it's way out of whack, either really high or really low, the blood will pick it up. But the urine and saliva are definitely going to be much more sensitive to smaller abnormalities. So yeah.
That's amazing. So when you're doing bioidentical hormones, is it something like the cream you apply once a day, or is it a cream, or is it sometimes a pill that's a powder inside of a pill as well, or is it typically only a cream?
So it depends on the hormone. With the estrogen, the Biest, that E3 and E2, it's a cream. I don't like to give estrogen orally. It behaves differently, because once it goes in the stomach, then it's going through the blood, the first pass hepatic metabolism. So it goes through the liver, and just behaves very differently. Estrogens also affect our gut flora when they're taken orally, and which it doesn't affect it in a good way. So the estrogen is given via a cream, and typically applied to the vaginal, like the inner vaginal labia, so kind of inside where there's not a lot of hair. And this may be too TMI for a lot of people, but you gotta get comfortable with it, because if you have problems with your hormones, your vagina might be involved. So be comfortable with that word.
Absolutely.
So, or especially if the woman's having vaginal dryness symptoms, very often I'll have her put it inside the vaginal canal. Most of the medication is then absorbed within about an hour. So like 90% is absorbed within about an hour. So very often I'll get the question, well, am I going to expose my husband if we, have intercourse? So the answer is, well, at least if you apply it an hour before any activity, that's fine. The cream, sometimes women can be sensitive to, usually not to the hormones, but to the base of the cream that they use. So they've got to put those hormones in a cream. So that's called the base cream.
Okay.
And sometimes women can have sensitivities to that. And especially if you're putting it on your, like a mucosal surface, like inside the labia there, that's a sensitive area. So sometimes people will get irritation from that. And then what I'll have them do is put it like on their inner thigh, for instance. Now, because that's thicker skin than a mucosal skin surface, sometimes you have to increase the dose a little bit. But that's a situation where we can do another test. We can kind of monitor the woman's symptoms, because usually they want to make it work. Because if they've been on it, they understand how well it works, and they are willing to, work through the kinks a little bit. So I would say maybe 5% of my patients have had an issue with the cream, and either we then apply it to the inner thigh, or we can very often just change the base cream to a different cream that they won't react to as well.
Oh, that's great. And then they can use this for long periods of time, right? So normally we think of, if you're going to do some type of hormone medication, you want to do it for a short period of time because we always have the risk. But with this, because it's bioidentical, it allows you to do it for longer periods of time. Is that correct?
Because it's bioidentical, for one, and because of the way most practitioners or prescribers are going to be testing and monitoring, it's a lot safer. So my requirement at minimum is 1 urine test per year. They run about $250. So I want to be careful not to do them too much. Sometimes insurance will reimburse for it, sometimes they won't, but I always want to be cognizant of the patient's budget as well. No matter how much money they have, right? We want to be wise with our resources. So my minimum is once a year to kind of check on both levels, but also how they're metabolizing. And then it also gives me a chance to check in with them and ask them physically and emotionally and everything, how are they doing? So, so that's kind of my minimum for testing. And that is one thing that makes it safer to be on these for longer, is we're monitoring, and we'll catch a problem relatively quickly if it's happening. Now, 3 of the sort of less noticeable benefits of the bioidentical hormone therapy, and regular hormone therapy has these benefits to a degree as well, would be the bone, brain, and heart. So the bones with osteoporosis. So estrogen is very involved in testosterone, in bone growth and bone maintenance, bone repair. And then the brain. So very often after menopause, we encounter things like dementia, Alzheimer's, right? This forgetfulness, this kind of inability to concentrate or focus. So the estrogens, hormones in general, are really important for our brain health. And then also heart health. So we know that the hormones are protective in terms of our vascular system, so our veins and arteries, how healthy and elastic they are, and the plaque deposits that we worry about. So those a woman is not necessarily going to feel like, oh wow, my bones feel stronger. I'm not hearing that in practice. So those kind of those benefits that are not physically apparent, a lot of those are reasons to keep women on these hormones for longer, because when I know we're doing it safely, and because I know they're getting benefit from it. And they don't want to come off usually either. If I've got them on hormones and I got rid of their hot flashes and their vaginal dryness, and they're having sex and they're having, great fun with their friends again, and their life is great, and I tell them, you know what, it's really time to stop those hormones, they're going to look at me and go, what? No. So, the risk, there is small risk with being on these hormones, especially depending on the patient's genetics. Again, how they're metabolizing the hormones, the estrogens especially. And so that's a discussion that we have. Are they okay with a very small increased risk of, for instance, breast cancer, right? And everybody's risk tolerance is going to be different there, but we have to have that conversation, because a lot of women are going to say, you know what, I'm 75 years old.
Yeah.
my life right now on these hormones is so much better quality than it was off of them. I'm willing to risk dying 5 years earlier and feeling good than getting off these hormones, not having cancer and living 5 years longer, or whatever the number is, right? You can't always put a number to it. But that is a discussion that we have, and of course there's consents to sign and all of that stuff, but they're really very safe. I have those conversations with my patients, but most of them would say I'd rather be on the hormones and feel good for less time than not be on them and live longer miserably like this. So it's very interesting.
Yeah. And that makes sense. I mean, quality of life is one of our most important
Yeah.
features and one of the things that we think about when we make most of our decisions. So I get that. Totally get that. And I love that you monitor, so they're constantly checking. Now, is there any, I guess, contraindications or certain people that you don't think would benefit from this? Like
Sure.
someone who's been on pharmaceutical hormones for a long time, or what are kind of the options?
Well, I switch people over all the time from
Okay.
pharmaceutical hormones, so that's not a problem. So if somebody's on the pharmaceuticals from their, OBGYN or their midwife or whatever, it's perfectly reasonable to find someone who's an expert in hormones, the bioidenticals, and switch over. I will say in terms of the bone benefit, if you get on the hormones within those first 10 years after experiencing menopause, whether that's a surgical menopause, like you had a hysterectomy, or whether it was natural menopause, or whether it was chemical menopause, maybe you had chemotherapy or something like that. If it's within 10 years of menopause, the bone benefit is more significant. Okay. So for instance, if somebody went through menopause at 50 and they don't come to me till 75, the benefit on the bones is not going to be as significant, but that's not a reason not to put them on hormones. Mm-hmm. We would just have to have that discussion and set expectations that, okay, maybe you went through menopause at 50, now you're 75, you have osteoporosis. The chance of us reversing that is minimal now, because it's been so long since you've had that good supply of estrogen in your body. Other contraindications would be, an active cancer. For sure, I'm not prescribing hormones to anybody with an active cancer, especially not an active female, breast cancer, ovarian cancer, uterine cancer, anything like that. And be very careful with that, because estrogen does feed certain types of cancer. And the last thing I want to do is feed somebody's cancer, regardless of whether or not it's going to make them feel better, because that's a licensure issue. So you do want to be careful with cancers, for sure. I always want to monitor the comfort level of the patient too. If a patient comes to see me and they really say, I don't know about these hormones, then I tend to say, okay, well, let's maybe see what herbs or nutrients we can use. Let's see how we can modify your stress and get you to handle stress better, or get you to sleep better. Because if people are not sleeping well, their hormones are not going to be well balanced during the day. They're going to be stressed and react to stress differently. Even how they breathe, right, is going to be differently. All about that. And so then I can work on other things. And that's a lot of what functional medicine does too, is, I'm not only prescribing the hormones here. I'm talking about, okay, what are you eating? I don't want you eating processed food and all that junk, because that absolutely has an effect on your hormones. If you're eating inflammatory foods, well, then our cortisol levels are going all over the place. And now that puts a stress on our hormone system as well. So sleep, stress management. To me, stress management is the biggest, hardest hurdle for people. I can get them sleeping, I can get them eating well, they can do a good job with that. But stress management is so meta.
Yes.
Well, what does that mean? You can't necessarily decrease your stress, right? And the hard thing is, stress management looks different for everybody. Maybe for some people it's going for a walk, and for other people it's deep breathing, and for other people it's praying. And stress management is the kind of the big piece that is hardest for most people, I feel like.
Yeah, I definitely agree. And we need more strategies out there. And I know what I do helps people immensely, but there are so many ways out there. And the more we talk about it, just improves what we do. So when someone new comes to you and they say they're having some hormonal issues, do you start with the stress management, the nutrition, the sleep first to get them into a different routine, then test their hormones, then figure out what compound they need? Or sometimes do you just start right away with testing hormones?
Yeah, it depends on the patient and it depends on their level of urgency.
Yeah.
So if they come to me and they are miserable, they are not sleeping, their relationship is in shambles, they're not having
Yeah.
sex with their partner, all of that, then, we're a little more likely to say, let's get these hormones started, a test and then get the hormones started. Hormones help with sleep as well. So a lot of times, even though we may want to work on sleep, for instance,
Yeah.
the sleep is not going to improve until we get, for instance, progesterone up
Got
to
it.
a healthy level. And when you're low in your hormones, you're tired, you can't focus, you're not motivated,
Mhm.
you're not motivated to make those changes that are necessary. So a lot of times I find a concurrent approach is best, probably for most people.
Yeah.
Again,
Okay.
because by the time they're ready to seek help, this is not a small problem anymore. They're seeking help because this is an invasion of their life. This is a huge problem in their life and they want help and they want to feel better. And if they feel better, then they can also start to make those better choices too.
Yeah, and I completely understand that. And kind of a follow-up question. So, as women, we know sometimes we say we're hormonal, or men in our lives say you're being hormonal. Those are maybe some more of the overt symptoms of our hormones being off. What are
Right.
some of the other signs or symptoms that your hormones may be affecting your health?
Right. So, things like, you go for your DEXA scan when you're 40 and, oh my goodness, your bone density isn't what it should be. And that's something we can't tell just from our daily,
Yeah.
symptoms. You may be getting headaches, hot flashes, memory problems like recall memory, where, oh God, I used to know the name for that thing. Oh, right. And you kind of fish for that word.
Hmm.
um, Sleep problems for sure. And definitely, of course, the hot flashes,
Yeah.
depression, anxiety, heart palpitations, the vaginal dryness, and even what seem to be recurrent yeast infections. I'm seeing this more where women, we kind of self diagnose. Oh, it's itchy, and so it must be a yeast infection.
Yeah. Yeah.
Well, a lot of times it's not. It's because that vaginal tissue is dry. And then as it rubs that little bit when we walk, there become these little tiny micro abrasions, which are, cause inflammation. The pH in the vagina gets imbalanced. And then the good bacteria get imbalanced. And that there's this whole cycle. And so whether or not it's overt or active bacterial vaginosis or BV, or whether it's just that pH imbalance, that can be a really big kind of warning sign of, oh, maybe something's wrong with my hormones causing the sort of the plumpness and the elasticity of the tissues in the vaginal area to kind of become more tissue papery, more
Hmm.
fragile. And then that just leads to a whole host of problems. And then women try and self-treat with over-the-counter monostat, and it just keeps
Yeah.
coming back, and they wonder, why am I getting all these yeast infections? Well, it may not be yeast. And so that's why they keep coming back, is because you're not treating it. You're not getting to
Yeah.
the root of the problem.
Right.
So
Right. That's great. And so let's touch a little bit on male hormones. So,
yes.
what are some of the things that you see with male hormones, how you help them?
Yep. So a lot of similar symptoms. Um, Weight gain, so a lot of fat gain, inability
Okay.
to gain muscle. So I'm working out, but I'm still like, I feel like I'm old and soft. Focus problems. So at work, their productivity goes down. They're not motivated as well to start projects or keep at projects. And so this is a big impact I see in terms of careers,
Okay.
because their motivation's down, their concentration, their focus is down, and then they get depressed, right? And then it's like a self-worth issue. I'm getting older and I'm not able to do this anymore. Well, that shouldn't really be happening. Certainly depression. And of course, then what we usually think of with hormonal deficiencies, testosterone deficiencies, is the erectile dysfunction and lower
Mhm.
libido. So certainly those can be, maybe the most bothersome symptoms to men, but also maybe not. I mean, the mood and the focus, the brain function, and even the muscle function, body composition symptoms are big for men. Right?
Yeah.
They're going through their life changes too as they're getting older. They may not have like a specific menopause, right, or andropause, but they are going through changes physically, psychologically, emotionally, spiritually as well, for sure.
Yeah. Yeah. And it's just as important.
Yes.
They may not verbalize it like we do, but it's still important for their image and their
Right.
ability to have energy and project well in the world. So I,
Well,
I
and
totally get it.
in terms of disease risk, so cardiovascular disease risk, diabetes disease risk. If
Mhm.
your body composition is such that your muscle mass is decreasing and your fat mass is increasing, well, now not only is your blood sugar regulation going to be off, you're going to gain more weight, right? But also fat cells produce estrogen. And so that's when you see, okay, well, they're getting the man boobs, right? Or
Yep.
gynecomastia. And you can see like the men with those larger breasts
Mhm.
very often have estrogen overload. And if they're
Okay.
already estrogen overloaded, then they're probably insulin resistant. And so it's just hard to back that train up,
Yeah.
especially from a traditional medical point of view. So functional medicine is much, much, much more effective at kind of backing up that train, reversing the insulin resistance, and kind of, yeah, reversing those disease processes.
Yeah. So if they have an estrogen overload,
Mhm.
what is the approach to change that? Do you match the other hormones so that they are at a correct level to match the estrogen levels, or do you somehow try to get rid of the estrogen?
Well, a little bit of both. So it
Okay.
has to be diet. You want an anti-inflammatory diet. Typically, we want some carbs in the diet, but
Mhm.
not high carbohydrates. Certainly, we want the good fats, the good proteins, and then like not really processed foods. So if you are eating carbs, maybe you're eating, lentils, for instance, and
Mhm.
beans, and I'm not a huge proponent of grains necessarily, but certain people are okay with grains.
Yeah.
But carbs are okay, especially veggies and some fruits, right? Berries are
Right.
really low glycemic index, so you want to pay attention to the glycemic index and have that be low.
Mhm.
In other words, less of a sugar burden on your system.
Yeah.
It's going to increase inflammation, which increases cortisol, which increases, inflammation and stress, and then there's estrogens and the fat cell, right? It's all this whole huge snowball effect.
Right.
So
Definitely.
other things they can do very often, men are aromatizing, and what that means is that they're turning a lot of their testosterone into estrogen, instead
Okay.
of detoxifying it in a healthier way. So zinc can be really helpful. So the aromatase inhibitors, but also 5-alpha reductase inhibitors. So zinc is a 5-alpha reductase inhibitor, and that tends to even out the way that the hormones are processed and detoxified. So zinc can be a really good first step there. Typically, I won't start a man who's estrogen overloaded, or symptomatically at least anyways, on testosterone until I have him on zinc, and potentially another aromatase inhibitor like anastrozole is a good idea of that. And very often for those men, if I do prescribe them testosterone, I'm compounding it with anastrozole in the cream, so that I make sure that we're preventing that testosterone from being converted over into estrogen.
Got it. That makes sense. And what a great way to help men who have these imbalances and
Yeah.
need that help. But some probably don't know that there are options out there.
Right. And what man is going to go to their doctor and be like, how do I get rid of these man boobs? Or,
Yeah.
like that's embarrassing.
Mhm.
They
Yeah.
a lot of times would rather just leave it be, but
Yeah.
find somebody who can help, because you don't have to have those. You don't have to feel
Yeah.
the way you feel. So
Yeah. So now people all around the world, how do they actually get these bioidentical hormones? Do they have to see a medical doctor, someone, and a nurse practitioner? How do they get them?
So the bioidenticals are prescription. So you have to
Okay.
see a prescriber, whether that's an MD, a DO, a nurse practitioner, a physician's assistant. And in different countries, in different states, naturopaths or NDs can prescribe
Okay.
also. You definitely want to make sure it's somebody who has experience doing this and doesn't just do it on the side.
Yeah.
Because there is finesse to it. There is an art to it. Yes, the testing can show you certain things, but there's real value in having somebody who's been doing this, and who maybe has gone to certain, educational, courses or something, to make sure that they're more trained than just, I read something about this and now I'm prescribing bioidentical hormones. Again, there's
Mm.
certainly risk to it, and you don't want to overdose. Certainly, you don't want to overdose somebody, but you
Yeah.
also don't want to underdose somebody, because then they're not going to get the benefit. And then,
Right.
oh, now bioidentical hormones don't work. Well, did they not work, or were you not managed properly, right?
Right.
Um, so a lot of times the Institute for Functional Medicine is a good place to start. The A4M that I mentioned at the beginning, so the American Academy of Anti-Aging Medicine, is good. A lot of times if you call a compounding pharmacy near you, the
Hmm.
pharmacists will be able to tell you,
Okay.
well, who are the prescribers who prescribe these, and who do they use most, and who are they getting most prescriptions from? And the pharmacist will even be able to tell you who they like the prescribing styles, and who seems to maybe pay attention better to their patients. So depending on where you are, and it might be a good first step actually to call a compounding pharmacy and ask them for the provider recommendation.
Yeah, that completely makes sense.
Yeah.
And when someone starts this, is there an easing in period where they start with a little bit of cream and then work their way up, or can they just go from 0 to 60 and
Yeah, typically only for my very, very sensitive patients am I going to ramp them up. People want to feel better faster.
Yeah.
And I tend to aim for the lower end of the range that I think somebody is going to end up needing, but I don't intentionally underdose initially. Again, unless these patients sometimes are very, very sensitive. They have a history of just having these really strong, powerful reactions to small doses of medication. And that tells me I need to be a little bit more gentle with them. But no, typically I will prescribe what I think is going to be the right dose, and maybe sometimes on the lower end of that range, and then monitor their symptoms. Sometimes we'll retest after a few months, depending on the situation.
Okay.
But again, that's, there's a cost involved usually with that. And if we can avoid cost, I want to avoid cost for the patient.
Mm-hmm. Yeah.
And then, but as long as we're doing it safely. And then, yeah, we kind of just adjust from there, doing the tests at least once a year, more often if necessary, based on symptoms or risk or whatever. But patients generally do really well on it. And because I'm a unique kind of provider, I run my own practice. It's just me. I don't have, a nurse or secretaries or anything that work for me. And so my patients know they can message me directly, and I can just, quick answer a question. Hey, my breasts are getting tender. What does that mean? What I should do? What should I do? Or I'm having some breakthrough bleeding. Can you tell me what to do? So I'm able to really manage very closely, if anything is kind of unexpected along the road.
That completely makes sense. So as we wrap up here, any last minute tips on what people should look out for hormones or learning about this?
Well, I would say, family history is really important to know. And so, if all the women in your family have had breast cancer, you may just want to get a hormone test to see how you're metabolizing hormones, even if you don't intend to go on hormones, because there are things we can do with, for instance, helping you methylate, like with B vitamins and, other things to help mitigate that risk. Certainly if you're having symptoms of menopause, even if you think it's too late, right? Like maybe you're 70 years old, it's not too late to at least look into them. And then doing the test doesn't mean that you're committed to taking any hormones. It just means that you're gathering information, able to make a better choice about what you want to do going forward. Even younger women and men with who are still menstruating, the women who are still menstruating and having maybe PCOS symptoms or infertility issues, hormone testing can be really beneficial in those instances, to figure out kind of what's going on. What's the root of what's going on here? You have acne, you have extra facial hair growth, you're gaining weight in your hips and instead of your belly, so different weight gain areas can indicate different hormonal tendencies. So to even just get a test, even if you don't intend to go on hormones, can be really beneficial. Even for women with PMS, a little bit of progesterone can be super helpful. Endometriosis, PCOS, all these things that are related to even female hormones or female reproduction we can really shed a lot of light if we do one of these in-depth hormone tests.
Yeah, that sounds amazing. It sounds like I would say most women in childbearing years and above probably should get one of these tests just to look at where they're at and say, hey, I'm having these symptoms. What are my hormones? Let's look and see if there's a correlation. So really appreciate that.
Heading into menopause, where are you? Are you well set up to go through menopause in a comfortable way?
Right. Yeah. Totally makes sense. So how can people get a hold of you? Please share.
Yeah, so I have my website, nourishhousecalls.com. And while I can only prescribe to patients in Illinois, I can certainly consult with other patients too.
Okay.
And then more recently, so I've been doing that for 2.5 years. Actually 3 years now, 3 years. And then my husband and I, because we have an autistic daughter, we have 3 kids, autistic daughter, we also have yourautismgameplan.com. And so what we're doing there, we're really excited about it. We felt lost and, so fearful and didn't feel like we were getting good information at the beginning of her diagnosis 6 years ago. And so we felt like, I have this expertise as a mom, but also as a nurse practitioner. I've treated her, I've treated other autistic kids. And so to just put information out there to help families, because it's so overwhelming, so confusing. You don't know where to look. You don't know if you're always getting the complete information, especially maybe in terms of the not so traditional treatments, right? So what supplements might be helpful, other treatments might be helpful. So I talk a lot about that. For now, the videos are free. You just have to, go to the website or go to YouTube. We're on social media. And then in April, we're hoping to come out with a kind of a very comprehensive paid course. So where do you start? Your kid's diagnosed with autism. Where do you go from here? What treatments are worth trying? So just kind of a succinct information, because none of us have time with special needs kids, especially, to spend hours and hours and hours like I did. We're doing all this research. So I felt like I did a lot of this stuff. We've been pretty successful with our daughter. I want other people to not have to feel so overwhelmed, but also be able to help their kids. So that's, we want to make sure we do the best for our kids.
Yeah, and that's wonderful. I know that's going to be a great resource, and can't wait to share it when it comes out. So keep me informed about that.
Absolutely.
Yeah. Well, thank you so much for joining us today. Really appreciate your knowledge and sharing with our audience. I know they appreciate it as well. And just thank you from the bottom of my heart.
I love talking about it. This is my passion. So I literally anytime I would love to talk about hormones with you.
Wonderful. And thank you all for watching today. Have a great rest of your weekend. We will see you next week. Take care. Bye now.